in.
My name is Kyle. I'm a nurse practitioner student at Clarkson College. I understand you're here for a well visit check, so
Yes.
we're going to do a head-to-toe assessment with you today.
Okay.
All right. I'm going to go ahead and just start. I can see that your head is midline, straight, upright. Facial expressions are congruent with stated mood. No obvious deformities, swelling. Hair distribution is equal bilaterally. Gray hair, thick, straight. I'm going to go ahead and palpate here. Just feel your scalp. No masses, tenderness. At any time when I'm touching, I'm going to assume there's no pain. Tell me if there's any pain, but I'm going to state no pain, no warmth, no redness. Normal cephalic. Go ahead and check your temporal. Maxillary sinuses, no pain, no tenderness, no redness, no swelling. Check your temporal mandibular joint. Go ahead and open and close your jaw for me. Thank you. No popping, cracking, creaking, crepitus. Can you clench your jaw tight for me? Check your masseter muscles and your temporal muscles. Good. Equal muscle tone. Trigeminal nerve intact. Then we'll check the sensory function of the trigeminal nerve. I'll have you close your eyes and you tell me soft or sharp.
Off.
Okay.
Sharp. Sharp. Soft. Soft. Soft.
Very good. Okay, so trigeminal nerve intact in forehead, cheeks, and chin. Then we'll go ahead and check your facial nerve. I'll have you close your eyes tight, raise your eyebrows for me. You can open your eyes again, sorry. And then smile, puff out your cheeks, and purse your lips. Show me your teeth. Very good. Equal bilateral movements, facial nerve is intact. I'll have you hold your arms out, straight out, and then touch your fingers to your nose on each side and close your eyes and do the same. Very good, perfect. So smooth, congruent, coordinated movements. Cerebellum is intact. We'll go ahead and move on to your eyes. Sclera is white, conjunctiva pink. No swelling, exudate noted. I'll have you follow my fingers here with both eyes. We'll check, just with your eyes, sorry. Track your vision here in the 6 cardinal fields. Good. Very good. So smooth tracking bilaterally, no nystagmus. Cranial nerves 3, 4, and 6 intact. Then I'll have you focus on the door behind me, and then on my finger, and the door, and the finger. Pupils accommodate appropriately. I'm going to come behind you. We'll check your peripheral vision here. You tell me when you can see my fingers.
Yes.
Okay. And the other side.
Yes.
Okay. About 90 degrees. Peripheral vision is intact. Optic nerve intact. Then,
There's a light.
on the ophthalmoscope.
Yes.
Okay, we'll use this as a pen light. Then I'm going to shine this just on your forehead here. Actually, can I have you lift your glasses for me so that they don't reflect? Thank you very much. Corneal light reflex is equal bilaterally, no signs of strabismus, no nystagmus when you were tracking with your eyes. I don't remember if I said that. Then I'm going to shine this bright light in your eyes. Go ahead and look right at my nose. Okay. Pupils are equal, round, reactive to light, direct and consensually, and accommodate appropriately. Then we're going to go ahead and take a look here in your eye. Actually, look on the side, sorry. magnetic disc is visualized. Crisp borders, blood vessels in peripheral, no nicking, hemorrhaging, or abnormality noted. Macula is visualized, no blood vessels in the macula, honey colored. Then we'll look at your nose. Midline, symmetrical, skin is appropriate color for race, no masses, lesions, no exudate. I'll have you look up a little here, and we'll look up your nose on both nares. Okay, some hair present. Nasal membranes are pink, moist. Turbinates are present, round, pink, no signs of redness. Exudate, I'm going to palpate here too. The ridge and the soft tissue, no tenderness, swelling. Septum is midline, not deviated, intact. Then ears are symmetrical, eye level, appropriate color, no drainage, no nodules, no masses, no deformity. I'm going to palpate your mastoid. No pain, no tenderness in the auricles. No pain, no tenderness. And we'll look in your ear. I'm going to pull up and back. Auditory canal is pink, moist, minimal cerumen. Tympanic membrane is visualized. Pearly gray, intact. Malleus, umbo, and light reflex are present. In a pediatric patient, it may be red if they were screaming or crying. May be prone to more retropharyngeal reflux as the eustachian tubes are more parallel, and I would pull the ear forward and down. Now your mouth, lips are pink, moist. Let me grab my tongue blade before I forget over here. Pink, moist, not dry, cracked, ulcerated, no blisters. Have you open your mouth for me? Okay, and I'm just going to kind of look at your gums and your buccal mucosa. Okay, gingiva and buccal mucosa are pink, moist, no signs of lesions, discoloration, masses. Teeth are present, patient's own teeth, ivory colored, no caries, no missing teeth, no dentures, no decay, no broken teeth. I'll have you open wide again. Use this light. And hard palate, sorry, I'm going to shine it in your eye. Hard palate is intact, dome-shaped, pink, moist. Go ahead and stick your tongue out and say ah.
Ah.
Very good. Soft palate is intact, pink, moist, pharyngeal wall, pink, moist, lighter pink. No cobblestone appearance, no postnasal drip noted. Tonsils are 2+. Pink, round, no exudate or swelling. Uvula rises with phonation appropriately. Tongue, now you stick your tongue out, down towards your chin, up towards your nose, and side to side. Good. Hypoglossal nerve intact. Tongue is pink, moist. Midline groove, appropriate distribution of taste buds. No ulcers, cracks, lesions, nodules noted. One more time, open your mouth and stick your tongue up in your mouth. Inferior aspect is pink, moist, vessels visualized. Base or floor of the mouth is pink, moist, intact, no lesions. Frenulum intact, midline. Okay, you can relax that, thank you. Now we're going to look at your neck. Thank you, I forgot about your glasses. It's going to be symmetrical. Muscular tone looks symmetrical bilaterally with sternocleidomastoids and the trapezius muscles. I'm just going to palpate here for any tenderness. Good, no pain, no tenderness, no masses, no lesions, no deformities. Skin is appropriate colored. And we're going to palpate your trachea. Trachea is midline. Go ahead and swallow for me. Thank you very much. And then we'll find your thyroid. Thyroid smooth, symmetrical, transverse across the trachea. Go ahead and swallow again. I know it's hard when I'm pushing on you. Thank you very much. Thyroid rises appropriately with swallow reflex. I'm going to palpate your lymph nodes, your preauricular lymph nodes, postauricular, occipital lymph nodes, your retropharyngeal, submandibular, submental, anterior cervical chain, and posterior cervical chain, and the supraclavicular. Lymph nodes are freely mobile, not swollen, not tender, not warm. No abnormalities there. I'm going to palpate your carotid artery. Good. Sides. And I would have checked both eyes as well. Sorry, I didn't say that. And we'll listen with the bell for a bruit at the carotid artery. Go ahead and take a deep breath and hold it. Okay, you can breathe. And same thing on this side, deep breath. Very good. Breathe easy. And I'm just going to listen to your temporal artery. No bruit heard. Very good. You shrug your shoulders for me. Good. And turn your head against my hand. And the other way. Excuse me. Spinal accessory nerve is intact. Strength in trapezius muscles is equal bilateral, and sternocleidomastoid muscles equal bilaterally. Then I'm going to have you tuck your chin down to your chest, flex that neck, look all the way up to the ceiling as far back as you can, hyperextension, good. Then look side to side, rotation, and tilt your head one way and the other. Good. And lateral movement, no pain, no popping, no creaking, no crepitus in the neck. Okay. Then we're going to move on to your chest. I'll have you take down your gown, please.
You can do whatever you need to do.
Okay. I'm going to untie you here. Okay, and I'm just going to watch your breathing for a moment here. Chest expansion symmetrical, respiratory rate 16 breaths per minute, easy respirations, relaxed, no sign of accessory muscle use or nasal flaring. Skin tone is appropriate for race, no retractions, no deformities, no masses seen. We'll go ahead and listen to your lung sounds. Skin to skin here. Take some deep breaths with your mouth open. Okay, and then I'm going to listen posteriorly. One more. Okay. Thank you. I'm going to go ahead and percuss your costovertebral arch here. So you're going to feel me push or hit on your back here. Any tenderness?
No.
Good. And the other side? No tenderness noted with pushing of the costovertebral arch. Then we're going to listen and check your heart. So I will, with the bell first, listen to your aortic valve, pulmonic valve, Herb's point, tricuspid valve, and your mitral valve. So I'm going to move your breast a little. Okay. And I'll listen to all those with the diaphragm as well. Those locations would be the second intercostal on the right sternal border, second intercostal on the left sternal border, third intercostal on the left sternal border, fourth intercostal left sternal border, and then fifth intercostal left mid-clavicular line. Okay. Heart rate is 60 beats per minute, regular rate, S1, S2 heard, S1 in the apex, S2 in the base. No abnormal murmurs, clicks, rubs, friction, or S3 heard. Lung sounds were clear and free from any advantageous lung sounds. I don't remember if I said that aloud. Then we'll go ahead and check your brachial pulse and your radial pulse. U plus, non-bounding in both locations. I'm going to check your femoral pulses. Sorry, it's kind of an awkward thing when you're sitting down here. Good. Your popliteal pulses. The post-tib. And then your dorsipedal pulses. Very good. 2+ in all locations, equal bilaterally, no bounding pulses noted. Check your upper extremities here. No masses, no lesions, no tenderness, no deformity, no swelling, no edema. Hair distribution is equal bilaterally, sensation normal in both. Then I'm going to check your fingernails here. Cap refill is less than 2 seconds. Fingernails are round, smooth, not cyanotic, or no signs of clubbing. And I'll check your capillary refill. I would check on both hands, on your toes. Good. Less than 2 seconds. Less than 2 seconds bilaterally. Lower extremities, free from any swelling, masses, lesions, deformities. Skin is appropriate color for race. Hair distribution equal, sensation equal bilaterally. Then we'll have you lay back on the table there. Sorry, there's no pillow. I'm just going to look at your abdomen here.
Could you pull out that
Yes.
tray, please?
Thank you. You betcha, I'm sorry. No, I'm going to just kind of expose your abdomen a little better here. No masses, no lesions, no tenderness, no striae, no surface movement noted. Can I have you lift your head up a little bit off the table? Great. Go ahead and rest down. No herniation noted. Muscle tone appears symmetrical bilaterally. We're going to listen to your abdominal sounds here. Okay, bowel sounds are active, audible in all 4 quadrants. And then I'm going to use the bell of my stethoscope, listen to your aorta, your renal arteries, and your inguinal arteries. brewy herd. We're going to go ahead and percuss on your abdomen here. Okay, no pain, no tenderness, dullness heard on overlying organs, tympany over the stomach. I'm going to go ahead and palpate, press on your stomach here lightly. Any pain, tenderness?
No?
Good. No masses felt, no abnormalities, and then a deeper palpation. Again, any pain or tenderness?
No?
Okay. No signs of any distress from the patient, no masses felt. We're going to go ahead and attempt to palpate the liver here under the right costal margin. You take a deep breath in and out. Thank you. Inferior border felt of the liver, no swelling, no tenderness, smooth. Palpate for the spleen, which is not palpable. I'm going to palpate your aorta. Pulses felt, no lateral pulsations. And we'll attempt to palpate your kidneys here. Vertebral arch. Heavy breathe in deep. Okay, and out. And the same on this side. Sorry, I want to get my hands in position. Breathe in deep. And out. Kidneys are hard to palpate, no tenderness, no swelling noted. I think that is all for your abdomen. I'm going to cover your chest again. Thank you very much. Then I'm just going to move your leg. We'll check the range of motion of your hip here. So we'll swing your leg out towards me for abduction and back to the center, adduction. I'm going to bend at your knee, and then we'll rotate your hip. External rotation, good, and internal rotation, good. No pain, popping, cracking, crepitus with the hip. I would check both sides for that. And then I think we can sit up again. Thank you. So now we need to run through a lot of range of motion. So, for your shoulders, I'll have you kind of flex your shoulders forward for me. Good. Shoulders are symmetrical. Raise an arm out to the side and all the way up. Abduction is good. And down to your side. Adduction, perfect. Bring it out in front of you and then all the way up as far as you can. Hyperextension, good. Then I'm going to have you kind of put your arms up, external rotation and internal rotation, very good. No popping, cracking, creaking, crepitus, or pain with full range of motion. Can I have you put your arms straight out, pronate and supinate, the elbows, good. And then with your arms out like that, just kind of follow my example and flex those elbows, good, and extend them. Perfect. And then, against some pressure, pull up on my arms. So pull your arms up. Good. Sorry, that was bad instructions. And then flip around and push down. Good. So biceps with the flexion and triceps are intact with the extension. Moving to your hands. Just kind of follow my example here. Can you wave your fingers? Okay. Metacarpal phalangeal extension and flexion intact. And then touch your finger to each finger to your thumb and back through. Good. And make a fist. Okay, thumb opposition test is appropriate, equal bilaterally, cerebellum intact. Have you squeeze my hands tight on both sides? Good. Strength equal bilaterally. While your hands are resting there, just have you flat and then turn them back for us. Good. Rapid alternating
You
motion.
have 5 minutes remaining with your patient.
Um,
5 minutes.
Intact. Cerebellum function intact. We'll have you flex and and extend your wrist, then radial motion and ulnar motion. Great. Okay, and then with your knees, I'll have you push your feet straight up, kick your legs, straighten your legs, good extension, and back down, flexion, intact, and I'm going to hold pressure, push against my hands, good. So quadriceps, strong, equal bilaterally, and pull against my hands, and hamstrings, strong, equal bilaterally. With your feet, go ahead and tip them down, plantar flexion intact, tip them back up, dorsiflexion intact, turn them in center, inversion and eversion intact, then push like you're pushing a gas pedal, great, and pull up towards your nose. Strength is equal bilaterally. I check your reflexes quick. Check your plantar reflex. So I'm gonna go with your heel, down across the ball of your foot, sorry. Toes curl appropriately, I didn't mean to stab you there. And check both sides. Then go ahead and relax your foot as much as you can. Check your Achilles reflex. Good. Reflex felt there, 2+. And your patellar reflex. Patellar reflex 2+, check both sides. Check your brachial reflex, actually on this side, rest your arm right. Perfect. Brachial reflex, biceps reflex is 2+ present. And we're gonna check your triceps reflex. And rest, good. Good. 2+ reflex, check on both sides. Then I'll have you stand up for me. And hips appear symmetrical bilaterally. We already checked the range of motion there. Gonna look at your spine, no pain, no tenderness. With palpation, no spasms, no deformity. Go ahead and bend over like you're gonna touch your toes, then forward. Great, sorry. And then go ahead and stand up tall. I should have timed that, shouldn't I? Mm-hmm. And then arch your back and look up towards the ceiling as much as you can. Kind of lean back as much as you can. Good. Hyperextension is intact. Then laterally bend over to each side. Lateral rotation. And turn just with your shoulders. Good. Rotation is intact. No pain, no tenderness, no hopping, cracking, creaking in the spine. I'll have you walk to the doorway and back for me. Gait is appropriate, strides appropriate length, equal, strong, coordinated. Now while you're standing just like that, I'll have you maintain your balance. Don't let me tip you off balance here. Very good. And then eyes closed. And same thing, maintain your balance for me. And don't let me tip you off balance. Good, strong balance, proprioception intact. And you can go ahead and have a seat. I'm just going to take a moment here and make sure that I haven't forgotten anything.
time with your patient is now complete.
you very
Please
much for your
exit the
time.
exam room now. Faculty, you now have 15 minutes for debriefing.